You're bringing up an extremely interesting point that I don't think a lot of people are covering. So, for example, out there's a lot of discussion about immunocompromised people.
Yes.
And the only way they're measuring that is, do you have diabetes? Do you have heart disease? Do you have a significant chronic health condition?
Yes.
And that's it. But you're extending this to a much higher level. You're saying
absolutely.
A healthy person who is sort of on the edge of being sick but doesn't know it because their body is fighting on several different fronts, may also be someone who could easily succumb, not necessarily dying, but have severe symptoms, not just mild symptoms, if they are infected by this. You want to
absolutely
on
that
a little bit? Yeah,
and that's why it's so important to do some of these elucidating tests, early on, to find out what is lurking underneath that is silently causing problems in your body. So, but like I was saying, everyone has a bucket of toxins. We can't get away from it. We live in a toxic environment. But once that bucket starts to overflow with all of these various things, then it expresses as disease. So, but it expresses differently in everyone. Everyone has a certain weak link.
How about some really common symptoms, just like constant fatigue, chronic pain, inability to sleep beyond, say, 6 hours a night?
Absolutely.
Those put people at risk?
Yeah, it can. So all of these things can mask as any symptom in the body. And that's what makes it so difficult and very confounding, I would dare say, for traditional doctors, because if you don't dig deeply enough and you just say treat the symptom with a medication, you're really missing the boat. So from a functional medicine standpoint, it really is a deep dive to really elucidate what is driving any of these things.
Well, you brought up a fabulous point that if you don't dig deeply enough, you may have your condition treated symptomatically. In other words, just a symptom.
Right, absolutely.
So are there medications or classes of medications that, if they're treating the symptom, might actually make you more vulnerable to a virus or infection of any type?
Oh, absolutely. Well, I mean, a whole host of medications can be culprits with that. Take, for instance, very common over-the-counter medication, any of the antacids, right? And some of the newer ones, Reglan, Pepcid, Propulsid, what have you. But the problem is, so yes, a number of people have reflux symptoms, right? But generally speaking, is never due to too much acid. Now there is a subset of the population that can produce too much acid. So granted, in some situations that may become necessary, but the vast majority of people, it's not due to an overproduction of acid. It's really due to too little. And the reason that the person gets these reflux symptoms is because they're not breaking down the food in the stomach very well. And that just comes back up. So addressing that with a less toxic diet, shall we say, and addressing it with digestive enzymes and supplements that can help increase the volume of the acid are much better. Now, why is that important? If you decrease the acid too much in the body, well, that's one of our main barriers for infection. The stomach acid needs to be strong because it is instrumental in destroying pathogens. So it's destroying
what I read today to that point is that, yes, you can breathe stuff in through your nose, but it all gets into the mucus. And
yes,
if you can drink a lot, you can actually wash the pathogen rather than into your lungs, into your stomach.
Yes.
Now your stomach acid can potentially kill this. So it may not get everything, But the dose makes the poison and the dose makes the cure. So the less we
Absolutely.
get into our respiratory tract, maybe the more resilient we are to fight these infections. So
Absolutely.
I've been sipping my water on a regular basis since I've read that, but also talking, it's just better to drink. But I think people don't drink enough, and they should
Yes.
just drink pure water. And the mucus is a very sticky substance. Dr. Trump used to tell me about fluoride, and kids would brush their teeth and then with fluoride toothpaste and swallow it. He says what you really need to do is you need to rinse your mouth with warm water 2 or 3 times and then spit it out to get the fluoride out. So the point is, the mucus will hold on to things.
Right. Absolutely.
Like a glue. So where is the mucus going? It's going down in the gut. And guess what? To your point, if the gut isn't there to knock these guys out, they can get through into the rest of the body.
Yes, absolutely.
What about steroids and drugs like this that can suppress the immune system?
Oh, absolutely. And that can be very common in scenarios where a person is given like a prednisone taper, like a Medrol dose pack for some, acute inflammatory process, or even for that matter, I've seen it, doled out for significant cold and flu-like symptoms and ear problems and so forth. But yes, that can certainly make you more vulnerable, because while it initially might have you feeling better, it is certainly suppressing the ability of the immune system to fight other infections. So, the same thing for the NSAIDs, the ibuprofens, the acetaminophen, and all of those things. And unfortunately, the opioids, and we are in an opioid crisis. Those all compromise the immune system.
The new class of drugs that are very expensive and being advertised prolifically, particularly for rheumatoid arthritis and psoriasis, they always say at the end of the commercial, tell your doctor if you have an infection. And I've looked at it actually, and they obviously are tuning down their immunosuppressants.
Yes.
So anybody on these drugs, you already have a condition. You have an autoimmune disease, which makes you vulnerable to start with because you have a condition. And now you're taking a drug that tunes down part or a significant part of the immune system. And it's reported to increase the veracity, efficacy of infection against you.
Right.
So obviously something like COVID-19 will be much more virulent in people taking these medications.
Absolutely. Absolutely.
The last one, Dr. Carter, that I know of, well, you mentioned some I didn't know of, but it's not well appreciated that the statin drugs in some people reduce cardiovascular mortality, but there's never been a study to show that they reduce overall mortality.
Right.
And one of the areas that's published, and this is a Kaiser study of people with HIV, that mortality increases when your cholesterol goes down.
Right. Yes.
And maybe you have a moment to comment on that, and also comment on some of the real cutting edge research that says this COVID-19 can mimic or morph into an HIV type.
Yeah. Well, with cholesterol, so most people know that there is a quote unquote good cholesterol and bad cholesterol, the HDL being the good and the LDL being the bad, which really they are not cholesterol. They are just carrier proteins for cholesterol and really the fat-soluble vitamins and all of the good things that our body needs to function. These carriers are needed. So they increase and decrease for significant reasons. So with the LDL, cholesterol is actually very antibacterial and antipathogenic. So cholesterol can actually be increased when there are infectious processes going on. So just trying to lower cholesterol by itself and not understanding the reason why it is raised can prove to be problematic. So yes, definitely that in and of itself, that is part of the immune system, believe it or not. And if you decrease that, that is one of the warriors that you've taken out of the lineup to help guard against infection. So, which again can potentially make you more vulnerable to the viruses. Well, any virus, not just coronavirus, anything.
Well,
So,
I have a chart of cholesterol levels versus all types of diseases and all-cause mortality from the World Health Organization, which I'll put up on this video. That I think is very, very telling. I like to see unbiased data. You know, the randomized controlled trials are sponsored by people who are looking for a cause and effect. But when you look at pure population data of a marker versus something like mortality or cardiovascular disease and just populations, I think it can be very enlightening as to what's really going on. So we'll put that up.